Hi there and welcome to Living Well. What is it to be living well? Well, living is in large part wellness. So this show has been created to tell you everything you ever wanted to know about your health, but your doctor forgot to tell you. Why did your doctor forget? Well, maybe you didn't ask. So when you call up that doctor, you know the one, Doctor Everything Will Be All Right, instead of asking him how much of your time is left, ask them these questions, the questions we ask today to a group of wellness experts, each with a story to tell. Joining us on the show, Dr. Nihid, a dentist who will discuss dental health as it relates to overall health, and Dr. Lewis E. Connor, a leading headache pain relief expert, and Emrys Hanley, a singer-songwriter who believes in the power and the healing power of music. Their expertise meets our questions right now on Living Well. And we begin with Dr. Pai. Nice to see you. Thank you so much for coming into our studios.
Thank you, Lawrence, for having me here.
Let's talk about dental health and how it relates to overall health. How does this work?
Dental health is the most important part of your well-being. You know, you'll be able to chew better, nutrition is well, and you'll be able to feel good about yourself.
All right, let's take people to your offices. The Wellness Secrets video cruise went there, and let's take a look.
Okay.
What I like about Dr. Pai's team is they really do treat you like family.
I'm her patient for 4 years, and I think from first time I just fell in love.
I wanted somebody who I felt really cared about my total health and wellness, and that's who Dr. Pai is, and so she is my dentist of choice.
Good morning, Dr. Pai.
Very nice to see you.
Absolutely.
I chose to be a dentist because as a child I fell down and broke my front teeth. I was very afraid of the dental office, the smell, the colors. It was my dream to have a dental office which doesn't look like a dental office.
So I came in today because I'm interested in straightening my lower teeth.
Patients don't have, if they're diagnosed with implants or root canals, don't have to go to various offices. Everything is done in-house. We have specialists who work here as a team to provide the best treatment. Okay, let's see how much crowding you have, okay? One of our specialty in our office is the makeover. We do all kinds of smile makeovers, from a simple laser whitening to a full mouth veneers. We provide a variety of cosmetic treatments here.
The thing I love about Dr. Pai is she has great experience. Her and her staff really do treat you like family.
I would recommend Dr. Pai to others because they would find in her like the best professional, the best dentist, and very nice friend.
This whole staff here is like a family, which is really amazing, and it's fun.
Well, let's start with dental aesthetics and why it is important as it relates to one's overall health. Let's bring in some pictures here to show some folks. And what are we looking at here with this patient? You
know, the before a picture where this patient has lost a couple of teeth because of poor periodontal health made her very shy, very introvert. But the next picture, you know, you can see there's a personality enhancement. It's not just stopping at the smile, but overall she feels very confident about herself. She feels much happier, and that's what a smile makeover can do to you.
All right, let's look at another photo here of another patient, a male patient.
Okay.
What treatment has been done here?
You know, this is a really simple treatment. All we these are called Serenade luminaires. And we just took an impression of this patient, no needles, no shots, no cutting of the tooth. And we did the veneers just by keeping his healthy tooth structure.
Okay, you talked about veneers. That may help some people. Other people may want braces or this new trend toward Invisalign. Let's take a look here at what the Invisalign is. How does this work, the Invisalign?
You know, Invisalign are clear aligners, and you change it every 2 weeks, and it works like braces. The only thing is that you don't have to show so much metal. And, you know, for people like you and me who have professional careers, it is difficult for us to get our teeth straightened with wires. And this is so much easier because it's painless, and you can go to your work. No one will notice that you're getting your teeth straightened, and then you'll have terrific results.
How long will a patient need to wear the Invisalign? And in a matter of months, what are we talking?
You know, depends from case to case, but generally, you know, it's 8 to 10 months, depending on how severe the crowding is. And they have to wear it all the time except when they eat their food. They have to take it out.
And then after that 8 to 10 months, is there another period where you wear it at night or something?
Yes, you have to have a retainer. Just like with braces, you have to have retention for life. You know, you have to wear it a couple nights a week for you know, the rest of your life.
Okay, now teeth whitening. You see on the shelves a lot of teeth whitening opportunities for people to just pick up in the drugstore. But really, do you do this at home, or is it something you do at a doctor's office if you're serious about doing it right?
Okay, Lawrence, it depends on a patient's commitment. You know, for home whitening, a patient needs to be very committed to the treatment because they need several of the whitening trays for several days. And because it doesn't have a barrier between your gums and your teeth, sometimes your teeth can be super sensitive even with one treatment. Versus in the dental office, they put a rubber dam which protects your gums, and it makes it much easier for you to do the whitening.
I've started seeing this guy who wanted to take out the amalgam fillings, the metal fillings that had mercury, and put in composites. It changes the structure, it feels, of your tooth. When you're dealing with taking out fillings, what's the story? If people need to go to composites right now?
You know, amalgams, the city has major fines putting amalgam in the sewage system. So if something cannot be put in the sewage, you know, definitely it should not be placed in the mouth because it has the mercury, it has the danger. But if you have existing amalgam fillings, should you start taking them off? No. Only the ones which are faulty, they need to be changed, of course, because they could be leaking. But, you know, it's safe to take them out, replace them with composite, and composite is a much better material of choice because it has the same coefficient of expansion as your tooth, so it does not expand or contract when you have hot and cold, so it creates less fractures in the tooth.
Because you're seeing people like in their 50s and 60s now who their teeth are cracking because they had the metal. I wanted to keep the metal because it's silver, you know, but they wouldn't let me because of the mercury, actually. But this is very good to know. And if there's more things that any of the people that are watching today want to find out about you and your practice, we encourage them to check you out on the web. There's a couple of places. WellnessSecrets.tv is a good place to start. And Dr. Pai, well, her offices are in Palo Alto. Her phone number is there on the screen. And if you want to visit, just call. Now, this wrinkle in time, can't give it no credit. Coming up, we talk headache pain relief for when you feel like your heart is crammed in your cranium and it still knows how to pound. That and more when Living Well continues. We're back in moments. Dr. Pai, thank you so much for coming in.